Everyone, this is Riddle Hug or Asia Raven, and today I'm going to talk about a very serious topic about a medication which is known as PrEP. Now, for those of you who might not know, PrEP is sort of a curative measure for people who are HIV negative but at a very high rate of, risk when it comes to contracting HIV themselves. So even though PrEP has been in the market and it has been FDA approved, it has been in the market for I think around 2 years, there's still a lot of misconception about who should take PrEP and what PrEP means and how it actually helps the body fight against you getting HIV infection. I'm going to answer some very common questions or try to answer them in a very easy manner so that you can decide whether or not PrEP is a thing for you. So first thing first, what is PrEP? PrEP actually stands for pre-exposure prophylaxis, and it is recommended for people who are currently HIV negative but are at a very high risk of contracting HIV themselves, which means that they are in a relationship with a HIV positive person, or their sex life is something that puts them at a very high risk of contracting HIV themselves. And also PrEP is also meant for people who drug use through injections. If you think that you fall under all or any of these categories, then you should really check PrEP out and talk to your doctor about taking it. So the next question is, how does PrEP helps your body against the HIV virus? Now, our body's immunity is through the T cells, and when an HIV virus enters your body, it actually uses the mechanism of the T cells to make billions of copies for itself and the body's immunity cannot stand up to the numerous copies of the HIV virus being produced, and that's why you get the infection, that the body's immunity just shuts down. Now, if you are taking PrEP actually helps fortify your T cells, and if an HIV virus does enter your body, it won't attach itself to the T cells, and thus no copies are being formed. PrEP a vaccine? No, PrEP is not a vaccine. Vaccine can actually help give you protection for several years. However, for PrEP you have to take a pill daily. If you keep taking PrEP, then your body will keep getting the protection against the HIV virus. However, when you stop taking PrEP, the protection will decrease, and after a few days it will end. And when it comes to taking PrEP, you need to take PrEP for a whole week for your body to create the immunity it requires to fight off against HIV virus. Now, you need to remember that taking more pills of PrEP will not increase your immunity to the HIV virus, which means that if you are supposed to take 1 pill a day, then that's enough. Taking 5 pills or taking 3 pills won't do anything else. It will just make you ill and suffer some side effects which you don't want. Now, is PrEP safe? According to research that has been done, the only side effect that PrEP or the people who have prepared PrEP warn the general public about is that if you take PrEP, some people might experience nausea and some type of stomach upsetting. So other than these symptoms, you are quite safe in taking PrEP. Just talk to your doctor about taking PrEP and everything will be alright. But first, before taking PrEP, you need to check whether or not you are HIV negative, and ask your doctor to run the whole test, the testosterone and everything, so that you can get a baseline regarding where you are before you start taking the medication. And when you take PrEP, you need to check with your doctor, I guess, every 3 to 4 months to see how things are working and whether or not you have the desired protection against the HIV virus that made you want to take PrEP in the first place. One of the most common questions about PrEP is PrEP a cure for HIV? No, PrEP is not a cure for HIV. It is, as the name says, it is a preventive measure. According to the research that has been done, PrEP can give you up to 94% of safety against the HIV virus. So it is a preventive measure and it is not a cure for the HIV virus itself. So in order to get really safe, you need to still use contraceptives during your sexual escapades, and yeah, and taking PrEP will actually help you make your body feel more protected against HIV, which means that if you are in a situation where you don't use a contraceptive during intercourse, and the other person is HIV positive, or he doesn't know, or he or she doesn't know that they are HIV positive, then having PrEP and having the buildup of immunity against the virus in your body can help you around to 94% or 96% when it comes to not getting the HIV infection yourself. So taking PrEP does not excuse you from not using contraceptives, so you need to do both. The next question you could be asking is whether or not it provides protection against other STDs. Well, no. PrEP is only for the HIV virus, which means that even though you are using PrEP, you can still contract other STDs such as gonorrhea or herpes and syphilis and other nasty things like that. So taking PrEP does not mean that you can't be infected by other STDs. So coming back to what I said before, that even though you are using PrEP, you still need to use contraceptives because you need to protect yourselves not only against AIDS, you also need to protect yourself against other STDs that you might contract. So yeah, I'm going to recap some of the things before I end this video, and let's get to it. First of all, what is PrEP? PrEP stands for pre-exposure prophylaxis. How does it strengthen your body? It actually strengthens your T cells against the HIV virus. It is not a vaccine, which means that you need to take PrEP one pill daily or according to your doctor, and when you stop taking the pill, then your body will stop showing any protection against the HIV virus. PrEP is recommended for people who are currently HIV negative but are at a high risk of contracting HIV/AIDS themselves because of their lifestyle or due to intravenous drug use. PrEP is not a cure for HIV, and it also doesn't provide any protection against other STDs. So you still need to use contraceptives, you still need to practice safe sex. When it comes to the symptoms that some people might experience include feeling nausea and having an upset stomach. Get yourself tested for HIV. If you have a lifestyle that puts you at high risk of getting AIDS yourself, there's nothing wrong when it comes to staying safe. And if you have any questions regarding PrEP, let me know down in the comments below, and I will be sure to help you find an answer. Until next time, stay safe, get yourself tested, keep other people around you safe, and yeah, stay blessed. I'll see you guys later.